Thank you, Chair, and happy Black History Month, 2 times today. I want to thank all of you for being here, and of course, I am a proud graduate of the University of Pittsburgh, and so I'll be directing my first question towards you, Chancellor. So we see that Pitt is number 6 in NIH funding, and I'm building upon my colleagues' remarks as well. And you know, as a co-chair, along with Rep. Curry and Rep. Cephas of the Pennsylvania Black Maternal Health Caucus, one of those NIH grants actually funds a maternal health center of excellence at the University of Pittsburgh, a multi-year grant that is examining equity in maternal and birthing outcomes. And so that work is, that research, especially with Pitt being a world-class research institution, helps us in our fight for Black maternal health. And so I want to ask again, you know, what is the strategy around the potential changes, decreases, or defunding of these research grants, especially as it relates to such an important topic as Black maternal health, not only for Western Pennsylvania, but for the entire Commonwealth?
Yes, thank you very much for the question. We're proud to have you as an alum, if I may say. The cut in indirect costs, or F&A funding for NIH, is of grave concern for a host of reasons, including the reasons that you described. Not only because that specific center is a center of excellence, but community engaged scholarship as a whole is a part of our research strategy. And traditionally, NIH has been a very strong partner in the example that you give and related types of health research, with the idea that successful health outcomes for everyone is a good thing, and that requires investigation and exploration into how you achieve that when the statistics would clearly show otherwise. And we have a lot of the leading scholars in this space, leading clinicians in this space, and as you all know, the community engagement centers that are keeping us very plugged into the community. Part of the reason we've been successful in achieving those grants is because it is community informed in us describing how we pursue the research. So in terms of our advocacy, the first step was to join in with the AAMC, which is the Professional Association of Doctors, and the other national organizations in a request for a temporary restraining order to keep the funding stable so that the change wouldn't be so abrupt, particularly in the cases of ongoing research like what you described, where the impact on the communities would be really harsh. And that TRO was granted nationally. The hearing on that is actually tomorrow, if you are so inclined. I'm sure it will be. We won't be bored, I'll say that. And we'll know more after that. Now, if that continues positively, then our advocacy shifts to the negotiation that we do all of the time in every cycle of federal research funding, in describing the importance of what we do, why we think it's important for the federal government to invest in it in the same way that we're doing today, and making sure that we're delivering that message to points of influence in an effort to keep that pipeline going consistently and sustainably. If the outcome tomorrow is harsher, then the advocacy shifts and we have to tighten belts. But the priority is community engaged scholarship, and so that would be last mile, I can say that.
Thank you for that update. I appreciate it, because this is a 6-year grant, and we know how it takes time to gain a learning, a knowledge, and understanding about such critical health issues.